Hi, thanks for taking a few moments from your busy schedule to view this brief introduction to our practice. I'm Dr. Kevin Flood. Dentistry has advanced light years into the future. The art and science of all phases of dentistry is not only exciting, but more comfortable than you could possibly imagine. Here at the Dental Health and Wellness Center, we have three goals. 1, to help each and every patient achieve their optimal long-term oral health. 2, to aid virtually anyone in realizing their dream smile. We call these incredible transformations smile makeovers. Today, we can recreate smiles and rebuild worn or broken teeth. But the most rewarding experience is the look on your face when you see your new smile for the very first time. Three, to perform our art with absolute attention to what I call extreme customer service. From steamed hot towel treatments which soften your muscles and aid in relaxation,
Oh, this felt really good, and it smells good too.
to back massage pads,
And you can put on the lower back, the upper back.
heated neck pillows, video DVD glasses,
Are you able to see everything all right and hear it?
Yeah, everything's working fine.
iPods, and herbal teas. We'll do everything we can to ensure more than just comfortable treatment.
My name is Stephanie Beist, and I'm from Wyoming, Michigan. I came to Dr. Flood in March of 2006 after being diagnosed in 2000 with thyroid cancer. I'd been struggling with my markers ever increasing, and I went to a holistic MD who recommended that I seek help in removing my mercury amalgams. And I went to Dr. Flood after doing some research and finding out that he was trained by Huggins in the removal of the amalgams and had the proper removal protocol. So I came in and I saw him, and he informed me that I had 11 mercury amalgams in my mouth. We had decided that we would remove the mercury amalgams from one quadrant for one each week for 4 weeks. And that would mean that I would be done with it with under 30 days, which Dr. Huggins had determined is a lower hit to the immune system. And especially for cancer patients who are already struggling with an immune system that's struggling, this is a good way to do it. He also did a biocompatibility test on my mouth before doing any of the restoration process, and that involves getting a blood test and sending it off to a lab where it was analyzed against over 900 products, I believe. And that ensured him that I would not have an allergic reaction or an immune reaction to any of the products that he restored my mouth with. So we did the restoration process over the 4 weeks, and actually within 7 days of the first quadrant being removed, I noticed that my brain fog cleared and I had increased energy levels, which was new for me because being a thyroid cancer patient, part of your problem is the metabolic side of it, that you lose a lot of your energy and you just really struggle with that whole process. So having more energy was a plus for me. By the end of the 4 weeks, I had marked improvement. I see a naturopathic doctor who was able to test my metabolic rate, my fat mass, my muscle mass, and he was able to determine that I had lost 10 pounds of fat, 8 pounds of muscle mass had been gained, and my metabolic rate had gone up just from having my amalgams removed. And he said this is not unusual. He had seen this over and over again. And in my research, I have determined that mercury is a huge metabolic draw on your body. So I was happy with those reactions as well. And the other thing that I suffered from was a very short temper. And I had a very short fuse with my children, and I noticed that this no longer happened either. I was able to keep my calm, and I didn't have the rage issues, which was amazing for me. So yeah, I was very, very pleased with the restoration, and I'm forever grateful.
My name is Brent Bonham, and I live in Grand Rapids, Michigan. And my boss actually brought me to Dr. Flood's office. He's a longtime client and brought me here after a bicycle accident. From the impact of the accident, I lost half of the front teeth, and then the other two were pushed straight back, pointing towards my throat. So the first measure was to put some orthodontia on to kind of bring everything back into place, and then rebuild the teeth, root canal them, and eventually put on porcelain crowns. The staff at the office was great. It turned out to be as good of an experience as it can be for situations such as that. I would recommend Dr. Flood. My experience here has been great. The biggest reaction that I got was that they looked more perfect now than they ever did even before.
Now that we've had you use the rinse, I will dim the lights down, and that will allow the glow stick to detect if there's any areas of cancer or pre-cancer. Sally, if there are any areas, it will jump out at us as bright as this white glow stick here. Have you lift your tongue all the way up for me? Great. Wonderful. Checking the back of the tongue, underneath the tongue. Okay, Sally, there is no trace of any cancer today.
That was really good to know.
Dr. Flood is a holistic dentist, which was one of the reasons why I chose him. He is very concerned about keeping you safe during every procedure that he does. During the removal process, he uses a filtration system that removes the mercury vapors. He uses an oxygen mask on the patient while they are having the removal done, and a dental dam to prohibit any of the pieces that are being removed from being swallowed. He also has ionic generators that are in each patient area that will capture the mercury vapors that are being emitted from any work that's being done on patients who still have mercury amalgams in their mouth. This protects the person who has a high sensitivity, like myself, to mercury from further damage after they've had removal. It has been seen that people who have mercury amalgams removed then show a higher reaction rate to the mercury vapors after they are removed and tend to react. So Dr. Flood placed these in his office to help protect that. Dr. Flood has an excellent staff here. I've formed a great relationship with pretty much everyone on staff and know each one by name. Each one is very knowledgeable.
Sally, what we have found, there's a hairline fracture on one of your back molars. I would like to take an intraoral camera picture.
What is an intraoral camera?
The intraoral camera is a means for us to be able to take an instant picture of what's going on in your mouth painlessly, and then it goes up on a TV monitor so that you can see visually what we're talking about with these fracture lines. So I'm going to go ahead. See, there are 2 hairline fractures in the distal buccal cusp of that molar. When we see the fracture lines in the teeth like this portion of the tooth could at any given time break away. And to correct this problem, what we would do is we would shave off a dime's width around the outer parameter of your tooth for the prep, and then we would put an all porcelain crown on that would fit over that and encase and hold everything together more solid than before.
I would recommend Dr. Kevin Flood to anybody who has anxiety issues about visiting a dentist. Not only is he very concerned about your health, not only from a mouth perspective, but also from your overall body health, but he is so compassionate and caring. So I would highly recommend him to anybody who's looking for a holistic dentist, who wants a more natural treatment approach and doesn't want to be forced into treatments that will harm your body further.